Specifically, our presentation is History Behind the Headlines, Discrimination Due to COVID-19. I'm Samantha Williams.
I'm Sabina, Cerne.
I'm Danielle Dance.
We came here in our first slide just to present a bunch of different headlines, basically to show like different things that came throughout COVID-19, which were like racism that occurred, discrimination, or even events that affect minority groups in different aspects as the pandemic continued on. The first thing is headlines, is racism and COVID-19. In our first slide, we just wanted to basically dwindle to one headline and talk about a general aspect of minorities and what's going on to continue as we go through our slides.
So what is happening in relation to COVID-19 and discrimination? Since the spread of the disease, we have seen an increased number of racially motivated hate crimes toward minorities in the United States. A hate crime is defined as a prejudice-motivated crime, which occurs when an individual targets a victim due to their membership of a certain social or racial demographic. We see COVID-19 and discrimination come together in several ways. One of the first ways being media further perpetuating these discrimination efforts. Notably, we see how diseases are named and how they have a large impact on the way the public perceives them. This is why there are certain guidelines against attaching a disease to a location. However, we know this is not always effective. Influential figures such as former President Donald Trump has come out with negative rhetoric about China as a source of the pandemic, labeling the coronavirus as the Kung flu or Chinese flu. This is both negative and harmful when it comes to discrimination. Next, we have social media in terms of isolation and COVID-19. People are turning towards media to stay engaged and connected. However, this has become a grounds for spreading hate and misinformation. We're seeing increased numbers of cyberbullying and generalized increased numbers of false information being spread through media. There's also extreme prejudice against Chinese people. And according to a study done by a communications journal, it was found that individuals are more likely to believe that China and Chinese people are to blame for the pandemic, depending on how influential social media is on their everyday life. We also see media outlets having a main factor in misleading headlines and news related to the pandemic. We're already aware that there's misinformation surrounding people's COVID-19 health protective behaviors. And we can see this misinformation transcend into an influential role when it comes to discrimination. We also are seeing scapegoating and stereotyping, which is creating misinformation and racial bias. We're seeing scapegoating with Chinese individuals, especially knowing that the first disease outbreak was in Wuhan, China in November of 2019. And this often acts as a place to blame for later outbreaks around the world. Lastly, we see that people have used the COVID-19 pandemic just to hide behind racist beliefs. So the influence on discrimination has on health. Discrimination due to disease is still very prevalent in today's time. Racism is a continuous system that threatens public health, and it is known that racial and ethnic minorities experience higher rates of death and illness compared to their white counterparts. However, it is important to note the pre-existing barriers to health before examining how COVID-19 impacts health. Employment, minorities are disproportionately represented as essential workers, meaning there's high prevalence, and are more likely to be exposed to COVID-19. There's also access to healthcare, which includes cultural beliefs in healthcare and health practices, means to obtaining safe healthcare, as well as limits on disease promotion and protection towards minorities. We have wealth. People of minority groups tend to have lower income status, therefore barriers in accumulating and obtaining wealth, which makes it extremely difficult to secure preventative healthcare, insurance, and other factors. Lastly is education. Lack in high quality education may lead to low levels of health literacy, which contributes to gaps in health disparities among minority populations. We also see lack of education And the topic of hate crimes may increase with this due to general lack of knowledge on the topic of how the disease spreads. Next, we have a quote that we felt summarized our presentation very well and brought together a main focus. So it says, COVID-19 has enabled the spread of racism and created national insecurity, fear of foreigners, and general xenophobia, which may be associated with the increase in racially related hate crimes during the pandemic. So some statistics and trends. We're seeing results determine that when compared to white adults, people from all racial and ethnic minority groups are more likely to have have experienced COVID-19 related discrimination. In general, there have been an increase in racial slurs, harassment, and physical attacks on minority populations due to the COVID-19 pandemic. According to the Associated Press, more than 9,000 anti-Asian incidents have been reported since the pandemic began. And according to a study done by the Pew Research Center, around 45% of Asian adults say they have experienced at least one of 5 specific offensive incidents since the start of the coronavirus outbreak. It is also noted that Black and Asians have been found to have increased instances of racially motivated hate beyond medical and financial concern. However, it is important not to dismiss other minorities that have experienced hate throughout the course of the pandemic. Lastly, a large majority of minorities worry that their presence in public spaces will be judged or that others will become suspicious of them due to their race or ethnicity. So as you can see, this is a supportive graphic highlighting several minorities within the United States, those being Asian, Black, and Hispanic, along with their white counterpart. We see that white adults have extremely lower reports of experiencing hate in several categories compared to other minorities. For some background information, this graph comes from a study by the Pew Research Center. There are around 9,654 respondents to this particular survey and had an overall 88% response rate out of the 11,000 or so sampled.
So for us in the United States, we see media from a very westernized point of view. The headlines below allow us to understand what is going on outside of the United States. For example, China, specifically COVID-19 discrimination against Africans, in Japan, healthcare workers discrimination and harassment, and Chinese Australians have said that the pandemic has sparked increased discrimination. We also have a statement, COVID-19 is not the only disease contributing to the history of discrimination.
So then we looked at like global parallels and basically, there it is. Okay. So in 1838, smallpox was named a sick man of Asia, and basically Canada had passed the Chinese Immigration Act, which placed a head tax on all Chinese immigrants. Also, quarantine officers were ordered to inspect all on board of Chinese origin, strip down and examine any Chinese person that was suspected to be sick. Also, that with spreading of rumors were done by missionaries that traveled around the world. They were still believed to come from China and America. So official reports still think that it came from China, but the CDC did change that, and it's now European settlers brought smallpox to America in 17th century. Now moving on to the 1880s, tuberculosis. Even after decades of burden of TB was associated with stigma, haunted African Americans. So like, for example, the Florida State Board of Health distributed pamphlets with images being of 2 Black males to encourage the public for early detection. 2 to 3 times higher in African American than white people is how often tuberculosis was found. And then by 1900s, became less common in white Americans in Virginia, just because of better sanitation and nutrition. public funding for fighting TB didn't happen for African Americans till the 1919. So moving on to typhus in 1892, U.S. Senate Committee on Immigration proposed legislation to tighten immigration requirements for Jews and Italians. So another thing was that Jewish immigrants were being blamed for the spread, and then they would quarantine them. They used excessive force and quarantined them in unsanctioned typhus houses for 3 months. And basically in those 3 months, there was a lot of people, I think around 120 people who died. So Germany wasn't any different, as Jews weren't allowed in German swimming pools. So moving on to 1916, the polio disease. Italians' mortality rate for polio were low. However, 1,348 cases of polio by those of Italian natives in New York were the highest for immigrant groups. Outbreaks started in Italian neighborhoods in South Brooklyn. And because of that, due to those tight spaces in neighborhoods and the views of immigrants rose the public image of them. Immigrants living in tenants surrounded by garbage and free roaming pigs was also to do with that. And with the rise of children having polio, started an anti-Italian prejudice. So then basically armed policemen patrolled roads and rail stations to prevent Italians from leaving the city.
So we wanted to focus more specifically on a certain disease, so we decided to focus on leprosy, which is also known as Hansen's disease, and it has a long history of discrimination. For example, some terms that many people have used for people who have had the disease are also known as lepers, which is a pitiful, disfigured creature that wanders the street, shaking a bell and crying unclean. There's also been a lot of religious discrimination. So in the Hebrew Bible, there's depictions of what God will do to the victims of the disease, and many people who are religious, and it comes from many different religions, also seeing it as a punishment by God. There are also laws against it. So in England in 1346, there were laws banning lepers from London. And India has 16 laws discriminating against people with disease. Some of the laws include grounds for divorce, housing, employment. More specifically, leprosy in Japan at the turn of the 20th century. Japan at that time was having high rates of leprosy, and it was considered a national disgrace. So during this time, they did enact a lot of laws. So in 1907, they enacted what is now called the Old Leprosy Prevention Law, which stated all homeless people are to be moved into isolation and put into a sanitarium. They divided the country into 5 regions, and in each region there was a sanitarium where they put all the homeless people. Soon after World War I, there were more public health policies and started moving more towards preventative measures. So in 1948, they enacted the Eugenic Protection Law, which legalized sterilization and the termination of pregnancy since it was believed to be hereditary. And in 1953, what is now called the New Leprosy Prevention Law states that anyone with the disease will be isolated in a sanitarium. So after these laws were enacted, and the New Leprosy Prevention Law from 1953 was not abolished until 1996. So that the district court had a hearing in 2001, and it ruled that it was unconstitutional and that the government had to compensate victims. And from the Foreign Ministries of Japan says that the government of Japan is taking the initiative in the efforts to eliminate discrimination against persons affected by leprosy and their family members in the international arena while taking into considerations of policies and experiences towards leprosy of the past.
Really, the significance of this context is awareness and realizing that the US and all over the world has an underlying issue of racism in the presence of disease that is yet to be taken, talked about, and still not understood by many. These headlines throughout the pandemic and now are signs that the issue isn't solved. And this has always been a problem, just like the statistics that we have discussed in COVID-19 has shed light on what minorities are still facing when Americans thought that it was a smaller problem than it is. Seems that in the presence of disease, there is a pattern of discrimination towards people like COVID and COVID now and leprosy before. History keeps repeating. The PowerPoint is not to recognize, the PowerPoint is to recognize that this also isn't just in the US and hasn't been the first time in history that discrimination has occurred with disease. This goes for other countries like Japan, and that also has have had social issues arise during the pandemic, as we talked about in other slides. All in all, this is a problem everywhere. It needs to be addressed and talked about from everyone to get to the bottom of the problem and be able to fix the historical systems that have divided minorities from whites.
So we have linked sources for anyone to go to. We've most importantly linked Meredith College's resources. So we have our non-discrimination statement and their COVID-19 notifications. For any more resources on specifically Asian American discrimination, you can go to the links under that.